Good afternoon, everyone. Thank you for joining our training session for Home and Community-Based Services, or HCBS Settings Final Rule, Community Integration, Provider Compliance, and Ongoing Monitoring by Hawaii Department of Human Services, MedQuest Division. My name is Dina Agnareingay. I am the Long-Term Services and Supports Nurse. With me are my interim supervisor with the Quality and Member Relations Improvement section with Kaneko, and also our guest speaker who has been involved with the Settings Final Rule project from the start and will be presenting for us today, Eileen Manuel. This webinar is in listen-only mode. The session is being recorded. For any questions during the presentation, I'm going to ask that you put them in the chat or Q&A box on the bottom of your screen. We will get to some of the questions at the end of the presentation. And for the questions that we do not address, the state will go ahead and compile and share our responses to all of you. Let's go ahead and get started. Take it away, Eileen.
Thank you, Dina, for the introduction. So this presentation is a series of the multiple trainings we do have available on our MedQuest website. So please pay attention to the number configuration of the training sessions that are available to you. So on the agenda today, we're going to talk about moving forward with community integration, briefly go over the federal requirements under the HCBS final rule. We'll talk about more of the ongoing compliance and specific information about the new processes we have stated within the memo that we sent out to providers just recently, and then just going over some provider resources for you. These slides may be familiar. There are slides repeated from our previous session, 300. People with disabilities have the right to make choices about where and how to live, including who supports them and what their schedule of activities look like. Be supported to make informed decisions. Live with privacy, dignity, and respect. Have the opportunity to seek job employment in a regular workforce, if applicable. Interact with the broader community. Develop and keep relationships with people without disabilities. Be supported in a person-centered way. And pursue a great quality of life. HCBS final rule, where are we going next? Reset our commitment to build a stronger foundation. We want to strengthen how we monitor and work with partners and work towards consistency and ongoing provider compliance. Continue to ensure person-centered practices across service systems. And never let a good crisis go to waste. Using COVID-19 as an opportunity to emerge stronger and with more integrated opportunities. HCBS settings final rule. What is it again? The rule identifies what is considered home and community-based and what is not. The goal of the rule is to make sure people receiving HCBS can live, work, and spend time in the greater community in the ways they want, including with people who are not involved in services. Each person's experience and their opportunity for community integration and participation is very important. To get more details on HCBS settings rule, please refer to HCBS settings final rule 300, community integration, labeled overview, refresher, and ongoing monitoring. This was done July 2022 and available on our website. So what has happened so far? The Centers for Medicare and Medicaid Services, also known as CMS, implemented the setting rule in 2014. In Hawaii, the plan called My Choice, My Way was approved by CMS on October 19, 2019. On a national level, all settings, both residential and non-residential, should be in compliance with by March 14, 2023. However, some states, such as Hawaii, received an approval by CMS for a plan of correction to work on settings review delayed during the public health emergency and have the opportunity to have settings that we were not able to review and validate, come into compliance by December 30th, 2023. Hawaii continues to work on provider compliance and ongoing monitoring. Community integration in multiple perspectives. For the credentialing process for any providers, we will talk more about what that process looks like using an evidence tool. Licensing and certification requirements. These are all um, required for providers that prior to being a Medicaid approved provider. We'll also talk about how the members' experience is involved in how we look at community integration. We'll look at some of the quality improvement activities that health plans will be responsible for to ensure community integration. And of course, the services and our oversight. Does the services align with what the person wants and envisions their life to be under the HCBS final rule? Validating ongoing compliance. So when we're talking about validating ongoing compliance, we're looking at multiple different perspectives. First and foremost, provider alignment of policies and procedures. This is something that the state was responsible for in ensuring so that we can be in compliance with the final rule. There were also changes made with the health plan credentialing and monitoring process to incorporate the HCBS settings final rule. We also are working on, with our health plans, to gather information based on personal experiences from members to ensure the ongoing compliance and validation of the final rule. Validating ongoing compliance. Specifically, let's get into more detail. For providers, alignment of policies and procedures. For any provider that becomes, for any provider that wants to deliver services to Medicaid recipients, some of them may require licensing and certification, whether that is from a different state agency, depending on what HCBS services you're delivering, ensuring that your license and certification requirements has language in there that the provider has to be compliant with the HCBS final rule. We also, as a state, had made an amendment. So we made changes to the Medicaid provider agreement and stated in there that not before, but in order for a provider to become to deliver services to a Medicaid recipient, that they have to align with the HCBS final rule. So we added language there. We also issued QI 2308 memo labeled HCBS Provider Implementation and Ongoing Compliance to provide providers more guidance on what to expect for the compliance for HCBS final rule. On a health plan level, the state has worked with our health plans in a process to ensure ongoing compliance, provider compliance with the final rule. This includes making changes to their credentialing process and including a process for ongoing monitoring. The language was changed in the Quest Integration RFP contract. The language was also added to the HCBS Quest Integration Health Plan Manual. And the health plans also were issued QI 2310 memo, HCBS guidance for implementation and provider compliance monitoring. For a new provider, MQD validation and health plan credentialing process. So this is for all new Medicaid providers. New to Medicaid, does not have a Medicaid provider ID number. So new provider, MQD validation and health plan credentialing process. A new provider must adhere to health plan policies and procedures for compliance with the HCBS final rule before being awarded with a contract. The health plan will pre-screen new providers to ensure that the provider has an approved Medicaid provider identification number issued by MedQuest, a completed provider self-assessment survey. A copy of that survey can be found on that QI 2308 memo, attachment A. And a validation check would be on file with MedQuest. So that's MedQuest staff validating a sample of providers, newly enrolled providers. For new provider MedQuest validation, just to take a step back a little bit, all of this information and the next upcoming slides are on that memo. If you have not received the memo via email, please look on our MedQuest website. We'll send information in email on how to locate that specific memo for that detailed information. Okay. Moving on. A new provider must create a new account and register on the MedQuest MQD's web-based provider enrollment system called Hoku. Here's a link. Actually, when you get a copy of the presentation, we'll send that via email as well. You'll be able to click on the hyperlink, but we'll share a direct link in the email. So you'll have that available and you can just copy and paste that onto your browser if you're wanting to do that as well. But these are instructions on how to register as a new provider on our Hoku system. Click on the Hoku training tab for available instructions and slide and training videos on how to enroll onto our Hoku system as a new provider. When you create your username and password, you want to make sure you keep your username and password, as well as the email address that you that you register yourself as. And make sure you write down your Hoku application identification number to log on to your application on this system. The Hoku application number is unique. It's a long number, so you want to make sure that you have that available when you log in. The provider will need to upload a copy of the provider assessment survey. On step 10, under document type, you'll hit the drop-down box and choose Other. Under document name, choose Miscellaneous. And then under Remarks, free text, enter Provider Self-Assessment Survey. Now our Hoku system will only take PDF as well as pictures. but I would recommend it in PDF format if possible. For on-site validation, so the state is responsible for making sure we validate some of the surveys that come in. We have our provider enrollment team screening 100% of our applications. But for validation, it would be under the discretion of the MedQuest division, or its delegate. So we the state can delegate another entity to validate some of the providers, the new providers that come on board. And validation can be done in person or virtually. For the provider self-assessment survey, like I said, this is for all new providers. If you don't refer back to the QI memo, you can also find the survey on our MedQuest website. Click on My Choice, My Way Provider tab for that information. If you have any questions in regards to uploading the documents that you need onto the Hoku system, please email HCBS inquiries at dhs.hawaii.gov. Okay. Step 10, for the ones that are familiar with our Hoku system, step 10 is where you upload all your documents, including the license and certification verification, your liability insurance verification. So this is one more document that we request for all new providers coming on board. Okay. This is a screenshot of how step 10 looks like in our Hoku system. Provider self-assessment survey, residential setting. When you go to our My Choice, My Way website, or if you look at the memo at the survey that needs to be completed, there's two different because it applies to residential and non-residential setting. The one that you see here is for the residential settings. Residential settings are considered community care, foster family homes, adult residential care homes, and expanded adult residential care homes as well. So please select the survey that applies to you as a provider. This one is for a primary caregiver for a residential survey. For all the day program settings, adult day health, adult day care, they specifically use the day program survey. The survey has not changed. Initially, when we started our assessment process back in 2017 to 2018. So the survey is pretty much the same for the ones that have been with us longer as a provider. So validating ongoing compliance. MedQuest, in collaboration with health plans, have created an evidence tool for providers and caregivers to help demonstrate their compliance with the HCBS final rule. So CMS had asked the states to develop a process on how do you ensure that the provider moving forward after initially being approved for being compliant with the rule remains in compliant with the final rule. So this is for existing providers and health plan re-credentialing process. An existing provider must demonstrate compliance with the HCBS settings rule by providing evidence of policies, procedures, and operating practices implemented and evaluated during the credentialing and contracting process with the health plans. This may include the submission of the provider self-assessment survey. If you have a copy of that you uploaded into step 10, or if you have a copy of it available Health plans may request for it, but we provided the health plans. Um, we will provide the health plans with a list of the ones that already have them on file, especially if you've been a provider with us since 2017. We would have documentation that you've completed a survey. If not, the survey is still simple to complete, so you can go ahead and complete another one if the health plans request for it. Provider attestation. So this one is new for ongoing compliance, and evidence packet. That one is new as well, with supporting documentation to the health plans. Okay. Um, the provider attestation and the evidence packets, there's examples on how that looks like on QI Memo 2308, Attachment B. Um, the health plans have the flexibility of making additions if they wanted to, but they were provided also a template on how and what to request for when they are re-evaluating providers for ongoing compliance. If a health plan determines that the provider does not demonstrate compliance, the provider shall notify the other health plans they are contracted with. So this comes with provider accountability. So if a provider knows that one of the health plans did deny them for whatever reason, please ensure to notify the other health plans. The health plans will temporarily suspend the new admissions and or services until remediated. So health plans will let you know if there's a time period that you could correct the changes, um, correct the deficiencies, and make those changes and improvements. Um, then you may continue to be a Medicaid provider. But until then, you will temporarily suspend new admissions. If the provider does not demonstrate compliance with the remediation timeframe, they will not receive reimbursement starting the day they were found non-compliant. If a health plan determines that the provider does not demonstrate compliance with the remediation timeframe, the provider shall notify all the other plans they're contracted with, and the plan shall terminate the contract. The health plans will have a validation process, including quality monitoring tools that they will use to evaluate ongoing compliance. The validation of settings may be conducted in person or virtually. The provider attestation and the health plan validation approval are valid for up to 5 years on the discretion of the health plan. The health plan shall provide technical assistance to the provider related to the contracting requirements as needed. So the provider, again, is responsible for submitting the provider attestation as well as the evidence packet. When the health plan receives all that information, they will go ahead and review and validate. Okay. Provider attestation and evidence tool. This is how attachment B looks like within that memo. Please review it. It was developed in collaboration with the health plans. So the instructions is to be completed. This one specifically, the example that I'm showing, is for the residential provider. So please pay attention to the tool that's being used. And this is also will be available on our MedQuest website. So if you don't refer back to the QI memo, please look on our website. Instructions, this is completed by the licensed or certified residential care setting. So we have information there, what type of setting. The setting must be integrated, least restricted, and affords the member their right to the full access and benefits of community living. Complete each section by providing a yes, no, or not applicable question. Just a reminder, this is a provider self-attestation. So read the question and respond accordingly. The provider must demonstrate compliance with HCBS rule and complete this attestation form. This form will serve as evidence of compliance with policies, procedures, and operating practices implemented and evaluated during the credentialing and contracting process with the health plan. Provider attestation. This is the section of the provider attestation. Check which health plan you're providing this to. Medicaid provider name, ID, and PI number if that's applicable, phone number, email, and your servicing address. Your servicing address, not your mailing address, because your servicing address will link back to what you registered for licensing and certification. Okay. The attestation box here, please just complete that. Put your name, your signature, your title, and the date. Please keep a copy of an attestation that you submitted to a health plan. For example, if you submitted a provider attestation and an evidence to Aloha Care, just make sure you have that copy on hand. It's a discussion that the state will have with the health plans moving forward on how they want to treat a provider that's already submitted and was approved for a specific health plan. We will provide more clarity and guidance once we make that determination. This is all new to the health plan as well. So our providers and our health plans need to work together, and we can continue with the state to make improvements in this process. But in the meantime, we want to make sure that you have all the documentation you have in place for each health plan that you submit this information to. Provider evidence tool. So these are an example of some of the questions for requirement number 1. So what we did is we have information on here and cited the CFR, the federal regulation and requirement. The questions are, some of them are very similar to what we had on the self-assessment survey. So we tried to align some of them there. But the self-assessment survey initially was simplified, and that was developed back in 2017. So for the evidence tool itself, so this we made improvements on. Health plans are encouraged to use the same tool for all providers moving forward. So you get a chance to review this. Are the member, for question number 1, are the members able to control their own daily schedules and activities? Now that would always be yes, because the federal CFR states that individuals have choice in their daily activities and their daily schedule. And that's something that you can work together on with your member to figure out their daily routines and activities. What is HCBS evidence? So this is a list from the provider attestation and provider tool. The provider must provide evidence to demonstrate compliance. Evidence documentation includes, but is not limited to, provider policies and procedures, member rights and responsibilities, member residency or legal agreement, example of a member choice of activities and schedule, example of member transportation log, example of member visitor log, member individualized schedules, member health and functional assessment, member health action plan, member rights and modification plan, photos of the physical service setting, training curriculum, attestation about training curriculum and materials as HCBS evidence. So let's go into more detail. Majority of the providers on this call are community care foster family providers. So let's take a look at that specific provider and what you can put together as part of your HCBS evidence packet. So when we're looking at provider policies and procedures, providers are required by their licensing and certification to have policies that comply with the regulations. For example, CCFFH policies. There was a sample provided by CTA on the website. Most of our CCFFH providers use that template um, as guidance when they develop their policies and procedures for their specific setting. Member rights and responsibilities. So we look back at what's required for a CCFFH policy number 12, client rights. Um, they focus on member rights and responsibilities. So for HCBS evidence that can be reviewed, and there should always be a copy in the member's record. So providing that copy to the health plan would be one way to meet that specific requirement of the HCBS rule. When we're looking at member residency or legal agreement, same here. CTA on their website, your licensing and certification requirement says that you have to have some kind of policy and agreement in place. So the CCFFHs have a sample that's provided to them, and anyone that signs that agreement, a copy should be in their member record. So that again can be submitted as evidence for HCBS final rule in meeting that specific requirement. Let's go down the list again. So example for member choice activities and schedules. There's language in CCFFH policy number 12, clients' rights. If you have this in the home, great. A monthly list of activities with choices. You have multiple members in your residence um, that you allow choices of activities for. And then most times, um, when you have individuals choose what they want to do, and then majority of them choose the same thing, then you'll have that available to them. I mean, ideally, that's what you want to offer. You want to offer choices. And then I had one provider say that they have what they do is they plan for the next month. So having a monthly schedule of activities or choices of activities can help plan what the individual wants to do the following month. An example for member transportation log, that is in your policy number 1 for staffing requirements. And at your home, majority of you probably have this already, but at transportation log, making sure that you are aware of who is using transportation, whether the provider is already providing it or you have the individual or the member using public maybe transportation to leave or family transportation, but you want to make sure that you have that. At least you can show evidence that having a transportation log and members using the transportation log have the choice to be integrated into the community. So you that aligns with the next one here on the list for visitor log. Um, Visitors can come in and out of the setting. So these logs track information, and you're not only having transportation, so that's integration out into the community, but visitor logs providing evidence that you have integration coming in. You have family members, you have friends, you have visitors that come and see your individuals. So that's overall what we see as integration. Member individualized schedules. So this is something that anytime you have your members choose activities, you're also documenting what they've done for the day. So a daily activities log is something that you can put together and you probably already have in your home, right? Just stating and providing evidence that this member chose to do this, and this is when they did this activity. Okay, so choice again, and then making sure you document their choice. For member health and functional assessment, so policy number 14 for foster homes, records and reports. This is something you can get from your case management agency. They're supposed to provide a copy, or you can request a copy from your case management agency. Always make sure you have that in the member's record, right? If you can, get a copy of the health and functional assessment as well as the health action plan. So that's the service plan. And there's a service plan after the individual is being assessed for what their needs are. The service plan gives you information and how to meet those needs. So all of that should be in the member record. Now, because you're providing this evidence, HCBS evidence to the health plan may have that already on file as well, because these case management agencies might be already providing a copy to the health plan. So that's why we have here provider to submit to the health plan as requested. So if that's something that they want as part of their evidence packet from you, make sure you at least put one redacted. So redacted means put all that, we don't want to see the individual's names. We want to make sure that we just have or see a copy of it. Member rights and modification plan. So this will provide a little bit more information. We may provide another webinar specifically for this. Individuals have rights. For example, the right to privacy. The right to privacy includes the right to close the door and lock the door if you're capable of locking a door. So with the HCBS final rule, we said, well, if one part of their right needs to be modified, we want to make sure that we write that in the health action plan, or the section of the health plan action plan that specifically modifies a specific right. So we'll provide you more guidance on that. We'll work with the health plans on how that looks like. I think at this time, our health and functional assessment and our health action plan do not have this specific section just yet. But once we do, we'll go ahead and share that information on what to look for. But modification plan specifically just talks about any modification of their rights related to the HCBS final rule. We said policy 14, records and reports. This is specifically towards the health action plan. So you'll find that information in there because you as a provider would be the ones to make those changes. If, for example, if an individual has to modify their right because their medical condition or their safety, there's a safety risk for them locking the door. So the modification will be provide them a door that they're able to close to create privacy, but then they're not able to have a lockable door. Okay. We'll provide you more information on that. HCBS evidence can include, this may not apply for our foster homes, but it's nice to provide that information because you're individual standing home, so you're already integrated within the community. But inside the home, it's part of the HCBS FIDA rule talks about accessibility as well. So individuals having access to specific areas of the home, that's something that would be nice for you to share. Making sure they have access, physical access outside. That's part of your licensing and certification requirements, that you provide accessibility outside as well as inside the house. Okay. Training curriculum and materials. So you want to attest that you took some training, especially when you're a new provider and you're like, I don't know what the HCBS final rule is. How do I get that information? So you have to attest that you reviewed some of the training materials that are available to you. Whether you get the training from the health plan, great. or you do that self-training and review some of the materials already provided to you by the state. Provider expectations, review the HCBS settings rule. There's training, like I said, that's available to you. The trainings are not very long. Um, some of the trainings reiterate the same information, um, but make sure you go through the training series, okay? On an annual basis, you want to at least do the refresher course, which is the 300 course. And then for specification, again, for the provider attestation and evidence packet, you'll refer to this session 400. You want to make sure you comply with your licensing and certification requirements, because we know already that you need to be licensed and certified before you become a Medicaid provider. You need to comply with the Medicaid provider agreement, because we, as a state, have put language in there that you're responsible as a provider to be compliant with the final rule. And then comply with the health plan contract requirements. Okay, that's for initial contracting as well as the recredentialing process. Moving on to training requirements, all providers must complete required trainings when contracting with health plans. This includes HCBS settings final rule overview, and this to review the process that ensures members that they have full access to the benefits of community living and are able to receive services in the most integrated setting, and are informed and supported to exercise their freedom and choice in selecting between institution and HCBS. Okay, so it's available to you. Like I said, the health plans may do a training with you on this already. If not, you're responsible to do this training on your own. Like I said, there's a whole series of HCBS final rule training on our MedQuest website. Person-centered thinking, there's a section on our website as well that focuses on person-centered thinking and planning to ensure that members make sure that they have a person-centered health action plan. It's driven by the member, offers informed choices, reflect what is important to the member, identifies the member's strengths, preferences, and needs. It includes goals and preferences, which are related to the relationships and community participation. Any exceptions or modifications of the settings requirements must be documented in the health action plan and meet the member's goals. So there's a whole series of person-centered trainings that are available to you on our MedQuest website. This is with the partnership with SDA. What's important to you, what's important to, and what's important for. Some of those sessions are in there. We just want to make sure you review that as well as a new provider and annually if possible. Providers must attest to having completed the trainings with the health plan, or self-attest that you did the trainings, reviewed the trainings that was available to you. Fact sheets are available on our MedQuest website as well. And if you search on our My Choice, My Way webpage and click on resources, you'll see all of that available for providers. Existing provider revalidation process. Okay, so when we talk about the MedQuest revalidation process, when you've been enrolled as a new provider, the agreement is to have your Medicaid provider agreement for 5 years. Okay, the MedQuest MQD revalidation process, you are advised again to go through our HOKU system. Make sure you follow that same process. We're gonna have you go to step 10 again. If we have the copy of your provider self-attestation, Um, Not the copy of your attestation, but the provider self-assessment survey already on our um, Hoku system. I believe that's one of those things that you don't have to update. Okay. What the things you do have to update, let's say you go through a new licensing and certification and your dates change, right? That's something that you update in step 10. Okay. For Hoku provider enrollment questions, please email hcsbinquiries@dhs.hawaii.gov. The provider will be contacted by MQD staff or delegate for validation check. The validation check may be conducted in person or virtually based on the discretion of MQD. Okay, so let's walk through this again. You're a provider within our Hoku system starting in the year 2000. 2000, let's see, 2000, 2015. Your Hoku application is good till the next renewal, which is 2020. I know those are old dates, but just visualize it there. Um, so the expectation is to update that information within our Hoku system. Okay. Um, Everything will be pre-populated when you go back into our Hoku system. So you only update the documents and the fields that you need to update when you do your MedQuest revalidation process. Transition of care for members. So for providers that do not demonstrate ongoing compliance, health plans will need to transition members to other compliance settings. The health plan will develop a transition of care plan for the member. The transition of care notification letter will be sent to the member and the provider. The health plan health coordinator will discuss different settings options in a person-centered planning meeting prior to the transition of care. The member health plan health coordinator and support network will collaborate to transition the member to the member's setting of choice. Okay. I highly encourage you as a provider to work with the health plan to see how you can remediate any deficiencies and how you can move forward so that we don't get to a place where we have to transition members. But if we do have a process here. When we talk about quality, the state um, did implement recently the HCBS CAP survey. This is used to measure member satisfaction of services and compliance with the HCBS final rule. An MQD delegate conducts the HCBS CAP survey. The HCBS CAP survey results will be reviewed by the health plan as part of quality improvement. Some of the questions in the CAP survey are specific to the rule requirements. So when a health plan, the expectation is that when the health plan reviews it and they find deficiencies in a specific area, they're supposed to develop a quality strategy to figure out how they can make improvements in that specific area. For example, choice. Um, Members have choice of providers as well as services. For whatever reason, the member says, nobody talked to me about other services, and that's reported in the CAP survey. Health plans need to make improvements in that area. How do they get that information to individuals and making sure that they're informed of the choices before they make a decision of what they want? So putting it all together, belonging in the community, making sure that individuals and members have full lives in the community. If possible, we want to make sure that they self-direct the services. That's including choice of what services and what providers that they um, want to move and have their services delivered through, making sure that they go through a person-centered planning process, making sure that members are participating in some of the activities that surround what they do on a daily basis, as well as being integrated and living that full life out in the community, as well as making sure that they have the ability to have integration within their home. HCBS provider resources. Um, so this is our website, My Choice My Way. You can click on the provider tab. That's an example of how that looks like. Provider surveys, the self-assessment survey, so paying attention to what's the residential versus non-residential. The final rule trainings, you have the list right here, 100 to 203. The 300 series was last year. That will be available on here, and this 400 series here will be added to our website as well. There's that section here on person-centered thinking and practices. Um, so those are the person-centered trainings that are available to you. Under the section provider monitoring and compliance documents, that's where we're going to put that information there. The examples that you see in the QI memo will also be up here. Please note that they are available for you to use. Health plans, if they request for additional information, the health plans will let you know. If you have any questions related to My Choice My Way, HCBS final rule, here's the email address. We encourage you to email us, and we will have one of our staff review we review the emails on a daily basis. So we'll try to respond to any of your inquiries when they come through. With that said, I'll turn it over to Dina. I'm not too sure if we have um, any questions in the Q&A that we want to address now. We can. How are we doing on time, Dina?
We're okay, Eileen. We have 30 more minutes. And I do have one question. The question is, how can the health plan ensure provider compliance? Is it via home visits like CTA annual visits?
Okay, so we allow the health plans to include that in their current processes. So if the health plans are doing in-home visits, I believe they can continue to do so. If you have health plans just requesting for the information, have you submit it? That's okay with MedQuest as well. So it all depends on which health plans requesting information. As much as possible, we did not want to interrupt their quality or their recredentialing process, but just including one more document to review to be included as part of that process is what we asked for. Any more questions, Dina?
Yes, we have one new question that came in. For a new foster home operator, what is the time frame for getting HOKU?
Can you repeat the question again?
For a new foster home operator, what is the time frame for getting HOKU?
For getting Hoku or approval?
Approval.
Okay, so that all depends on the documents that you submit initially in your application. If you are submitting all the documents that are required, um, I'm not too sure what the turnaround time is now for getting your application reviewed and approved. But as much as possible, at least from a provider standpoint, to make sure that you have everything on there so that they're not kicking the application back because you're either missing information or the information that you have there is invalid. Like dates have to align with whatever documents that you're providing. You want to make sure that you have your licensing dates aligned with your actual license because they validate that. Your copy of your certificate of liability insurance, making sure that that's up to date. And this requirement here of making sure that you have the survey on file and making sure that you upload it there as a miscellaneous. That's something that they're starting to look at as well. But if you have Hoku related questions, we refer you back then to HCSB inquiries. That email address, if you have questions related to provider enrollment. I cannot guarantee you that the um, turnaround time is, um, I cannot guarantee a time frame, I guess, on when they're going to review and approve it. But as long as you know that you submitted the documents that are required, then you should be good to go. Any other questions, Dina?
There are a couple more questions related to Hoku, but I think we have to take it back to our provider team for this one. So for these questions regarding Hoku, I can email you the responses. There is another question, Eileen. I don't know if we can answer this now. If our clients has a history of elopement, can we have a MD order to lock our main doors?
Okay, so that would be a part of your health action plan. So when you as a provider are working with your case management agency and you identify that this individual has wandering or elopement behavior, you want to make sure that's documented somewhere. And the health action plan has the intervention on how to minimize that risk. And if that includes locking the front door, that you want to make sure that it's documented somewhere as well. So work with your case management agency. Like I said, that section for modification of the modification plan, that section is not available there. So if case management agencies are doing documentation now, they should be at least documenting that within their progress notes or somewhere. Well, we can provide you more guidance on that, um, on how that looks like.
Thank you, Eileen. There's more questions. For the transportation log, do they still need to have them in their member book, even if they don't use transportation?
I don't think it needs, so the transportation log, if that is available in the member record, great. Um, Sometimes what it asks for is just an example of the transportation log, right? Sometimes you'll have that for all residents to use, so you have one main one out somewhere. Same with your visitor log. When you have your visitors come in, you have one visitor log. So providing just an example of it should be sufficient enough to meet that requirement. You have that available for the ones that do use the transportation.
Thank you, Eileen. Next question. Do we need to print and put all these HCBS rules in our CTA binders?
It's not, I wouldn't recommend putting it with your CTA binder because your CTA requirements for licensing and certification are different. I would probably recommend that you have this separate, maybe keeping all of these documents separate somewhere. Um, A separate binder is good too if you want, and then everything that you submit to one health plan will probably be the same information you submit to the next health plan. So keeping yourself organized. I did make references in these slides for which specific part of the policy. So if you're one of those providers that are using the sample policies that are available to you by CTA, just even flagging those specific sections where it applies. When health plans are asking, are you, do you have a transportation log? Do you give them the right to visitors? You have certain sections in there in the policy that have exact language. So CTA has done a good job with um, making sure that the language is um, in there that aligns with the final rule. So if you read it more closely, you do have language in there. Um, and health plans can see it. If everyone's using the same one, great. I think CTA allows the flexibility of having policies be amended, so changed a little bit or more specific to your setting. I'm not too sure how many of you actually do that, but what we provided as far as examples today are related to what's available to you now by CTA. So just going back then to that original question, yeah, I would try to keep it separate. So you know which one is HCBS rule related and specific to what the health plans will ask for. And then whatever you have for CTA is specific to what CTA will ask for during their licensing and credentialing process.
Okay, thank you. One more question. Since we're giving an access to our clients for their foods, what about if they have diabetes or any other illnesses that needs them to comply to follow their diet?
Okay, same thing. So when you work with your case management agency does their health and functional assessment. They identify that the individual has a special diet or food limitations or restrictions. So of course that's going to be documented there. And then in their health action plan, the health action plan should reflect that then, and how do you mitigate that risk? Um, and how not mitigate the risk, but how do you ensure that then they're aligning with what was ordered specifically by the physician when he says somebody with this diagnosis has to, limit sodium intake. Then that's going to be reflected in the health action plan. So at least at this time, those would be the two documents that health plans would probably look at, whether they identify on the health action plan, how that's written, and how they identify that in the health and functional assessment, and then how that's reflected in the health action plan. Um, that's how they're gonna make the connection for a member that has some kind of limitation or restriction to their diet or even access to food. I hope that makes sense. I know I repeated it multiple times and in multiple ways, but those two documents you should be able to track what was identified, and in the action plan what you're allowed to do as a provider.
Thank you, Eileen. Next question. Visitors log is required for 3 beds foster homes per CTA. Is that now required for 2 beds?
So that sounds like it's a licensing and certification question. So I'm gonna have probably Dina reach out to CTA and see if she can get that answered for you.
Yes, I can do that.
Thank you.
The other questions that I have are related to Hoku. So for these ones, we will get back to you separately after this meeting. Are there any other questions related to the final rule?
Okay, so I'm gonna have you all stick around for a little bit. I'm gonna have Dina stop the recording. Dina, let